During elbow shock wave therapy, the high-energy shock waves delivered to the affected area create microtrauma, which triggers the release of growth factors. Growth factors are naturally occurring substances in the body that play a key role in tissue regeneration and repair. The microtrauma caused by the shock waves stimulates the body to release growth factors such as transforming growth factor beta, TGF-β, insulin-like growth factor, IGF, and platelet-derived growth factor, PDGF. These growth factors promote the growth of new blood vessels and help to stimulate the production of new tissue in the affected area of the elbow. TGF-β, in particular, plays a critical role in the regulation of cell growth, differentiation, and extracellular matrix production. It has been shown to be involved in the healing of tendons and other connective tissues. IGF is another growth factor that is important for tissue growth and repair. It promotes the proliferation of cells and stimulates the synthesis of new proteins, which are necessary for tissue regeneration. PDGF is a growth factor that is primarily involved in wound healing and tissue repair. It helps to stimulate the growth of new blood vessels and encourages the migration of cells to the site of injury. Overall, the release of growth factors during elbow shock wave therapy plays a crucial role in the body's natural healing process.